Thank you, Anand, and all of you here. I think I'm just going to talk a few things about it. Why? Basically, I think when we published in 2009 in Retina, we saw that the unfavorable outcome was almost close to 30%. And we also looked at other study of zone 1. Those days, you can see here from Chile and from US and other countries, the percentage was quite high. So, and here, of course, this is a recent study where we only did laser. 79% of the eyes had an unfavorable outcome if it was a posterior zone 1 or a zone half ROP. I think so. I think these were some of the things. I think this is the zone, what they call as posterior zone 1 or zone half. You can see it, they are not reaching even the fovea, and it is just by the side of the disc here. And in this, the laser was done, even the stretch breaks occurred. And so that is what is the problem. And we may have a situation like this sometimes, although Anand did mention that it can dilate and stretch like it happened in this case also. But sometimes it is so hazy, you can't do much of treatment, incomplete treatment. Or sometimes even you may feel that this is the eye, when it is manipulated more, they start even a little bit bleeding or oozing. So, or eye like this, those who need like perhaps something else to be done along with laser. So basically, I think at this time, zone 1 and APROP are less responsive when need laser. Difficult situation I have shown. And sometimes the disease may progress despite your good near confluent laser, which nicely mentioned by Dr. Subhadra. And anti-Vegf may be followed by less extensive laser. That is what is a big advantage, I think. We are not killing the whole retina. Of course, we all know that it started all with this beta-ROP study, which had given us that zone 1 stage 3 is a preferred modality for this. And now, of course, with the rainbow trial, and also I think if you go to Cochrane review, I think we have a here from RP Center itself, Parijat Chandra is also part of this Cochrane database review. And that anti-VEGFs are slowly becoming more acceptable all over the world. Most would use in APROP and zone 1, I already said. And recent trial has advocated ranibizumab for type 1 ROP, because this has been approved. That's how many people now feel more confident. After anti-VEGF, additional laser may be required for reactivation or persistence of disease. And the late recurrences and systemic advance are a concern. But I think as we are following them longer, our concerns are sort of going down on that. Of course, injection is simple, easy, and does not require special expertise, possible under topical anesthesia, and we get a rapid response. That is what is very important. I find that laser takes time, and here you would have a very rapid response. You may preserve more visual field, less myopia. Well, that is still sort of there, debatable, but definitely these cases, since we destroyed less retina, I think that is what basically our aim is. What are the problems? Even the questions which are were put to me, some of them would be answered right here. We don't know whether we should do purely a monotherapy or a combination therapy. I think we need both. Sometimes it is monotherapy may be good, but combination may be required in many. Which anti-VEGF and dose? Big debatable question. Still many people feel Avastin is more effective, more this thing, but then there are other issues with Avastin. Even the systemic absorption is more, which has been shown. And dosage still about even all anti-VEGF. We are not sure. Most of us still use half dose because that is what Rainbow trial used. Eyes treated with anti-VEGF should have a long-term follow-up. That is very important. We don't know the duration. Again, somebody is going to ask, what is the duration of follow-up? We don't know how long we have to follow them. And the late recurrences are possible. I'll show you example. And systemic adverse events still, I think this is a concern. I think I'm just showing you one baby here. I think this is way back in 2016. And you can see this is status post Eylea. Half a dose has been given. And you can see how well it comes down very fast. And then you could laser and get a very good outcome. And laser is perhaps not required. This is also a question posed to me. If the vessels have reached zone 3 or has already gone to ora strata, of course, then and there's no reactivation. In fact, Dr. Swadra would remember there was a great lecture by Susanna about FA in such cases, and she had shown certain features that if you see these features, of course, we can't do in every case. Then perhaps we can watch. So that is also very important, which cases we can watch and which are the cases we have to laser. I think that is where we have to work also. And that is where I would request Anand, since he's working on that, he should work on in that area. And of course, ideal at this time is a deferred laser. So wait till the time the vessels are growing, the disease is not coming back. It is not really, although we don't know what would be the exact point at which we will laser. But deferred laser definitely will save more retina. And anti-VEGF injection will be followed by, and I already said that, less laser. And of course, combination is still required for AP, ROP, and zone 1 ROP, but more so always in posterior zone 1 ROP. Maybe here the surgery would also be required in many cases. So all three may be required. And you're going to ask me which combination should be done first. If you have more traction, you have something like a blister like ROP, or you have already raised, then first do the laser and then anti-VEGF. In case you don't have proliferation, it is like a typical AP ROP, zone 1 ROP, then you can first give a, I think, anti-VEGF and subsequently may do laser if it is required. And inadequate laser treatment due to hazy media, I already mentioned about that. I've shown you some of the examples, and these cases definitely they get benefit. I have shown one case here. You can see there was a vitreous hemorrhage, and in this case, we could have a successful outcome. Even Zhao has published such cases recently. And combination of laser and anti-VEGF, I think I have already mentioned this. I'm not going to repeat this again. And this is something which, and I just wanted to show you, I think typically we were doing this. We were going all the way here. And then somehow we started sparing zone 1. I think that is what, but at this time, after anti-VEGF, if we let these vessels grow into zone 2, and if that stage we need, I think we are saving a lot of retina. I think that is what, in fact, our this thing should be. But I don't know still, I keep showing this many a time. Some of you have seen this. Despite anti-VEGF and good laser, there was a problem here. We didn't follow for some time, and we got this kind. I thought if we had seen like this, I must say, it is a proper laser, good laser which works, not the inadequate laser, which happened with many people. That's how it does. It fails. If you have done a good laser, it will be definitive. Also, the laser has another advantage, which I keep telling also. If you have lasered the retina all the way, I think that late retinal detachment or the late problems are never going to happen, because they will all happen in anti-VEGF eyes, because we'll have a lot of changes happening in the periphery. So that's why long-term and follow. So in conclusion, I would say most use deferred laser after initial anti-VEGF at this time for AP ROP and zone 1 ROP. And obviously they use before anti-VEGF because of rapid response. And indication for laser in ROP are decreasing and changing. I think soon we'll not have now ET ROP guidelines for laser. We'll have a different guideline. These are also going to come soon. That is what would happen. And anti-VEGF injection is mostly followed by less laser. This I have emphasized. And we need a deferred laser. It helps to preserve more healthy retina. Maybe the visual status itself may be better. I think that's what we need to preserve and do. Thank you very much. I think I'll be open to all the questions or whatever.